Well, welcome. My name is Paul Baccio, and along with Doug Fogel, have co-authored a new holistic technique, how to get permanent relief from chronic tension headaches. And I'm here today to introduce this new headache technique. Now, what this technique entails is a series of gentle moves over specific muscle groups and body points. And what it does is it signals the tissue to relax and realign. And despite the very light touch, the tissue will actually relax at a very deep level. And as that tissue relaxes, it will no longer put tension or pressure on the nerve endings in the head and neck area that cause your headache. Now, the vast majority of tension or tightness in the head and neck area comes from poor posture. And unless there's some overriding trauma, say you fall out of a tree or you're in a motor vehicle accident, everything that I see here in the clinic is all based on poor posture, poor mechanics. And what happens is you put yourself in a kind of a slumped forward head, rounded shoulder posture, and you keep yourself in that position 8, 10, 12 hours a day, 5, 6, 7 days a week, week after week, month after month, year after year. And eventually what happens over time is the tissue begins to tighten, it tears, it scars, and then eventually pushes on the nerve endings in the head and neck area, and that's where you get your headaches from. Now, this technique has been researched. I've studied it for over 10 years now, and it's backed by clinical experience, treating real people, getting real results. Now, this is not a technique that you can do on yourself. However, there are certain points that you can stimulate that will help relieve your headache during the day. So, let's get started. All right, so what we're going to do here is we're going to start the headache sufferer on your stomach or in the prone position. And we're going to do some releases on the upper back here to start, and then we'll turn over and work on the head and neck area. But before we do that, I'm going to show you the basic move that we're going to use throughout this technique here. So the basic move goes across the tissue. So what we're going to do is we're going to take fingers here, and we're going to push the tissue, and then we're going to dig in just ever so slightly and pull back across it. So it's a push and pull, push and pull, push and pull. And it's always a push and pull technique, and there'll be two instances where we're going with the muscle instead of across it, but it's usually perpendicular, a push and a pull. And it doesn't have to be very deep, and it doesn't have to be very hard. Actually, it should be quite gentle and quite relaxing. All right, so let's begin. We're going to start by releasing right next to the spine. Now, this is the one instance where we're going to go with the muscle instead of against it, but it's the same technique. You find the spine and come down right off to the side, and it's going to be a push and it's going to be a pull and a push. Pull the tissue, push it, pull and push, and we're going to follow right next to the vertebrae all the way up to the neck. And then we're going to come back and we're going to go to the opposite side. Again, find the vertebrae, go over the other side and right next to it. In fact, while you're doing this, you should actually feel the vertebrae next to your fingers. And again, it's just a pull it and push it, pull and push. And again, this is not a deep tissue technique. This is all very gentle. So once we're done with that, then we're going to open up this section of the back here. So now we're going to release the upper part of the back here. And what we're going to do is we're going to close it off here and here. And by closing it off, we're going to do the push and pull technique, but we're going to push toward the spine here. So go right next to the spine, and just on the other side of it, we're going to pull away and then push toward it. And the same thing on the other side, we're going to push away and then pull toward it. And then we're going to come up here, right at the top where the neck is. And we're going to do the same thing. We're going to pull away and push toward the spine, push away and pull toward the spine. And then right in the middle of those 2 points that we just opened up or closed, we're going to open. So we're going to push toward and pull away. Push and pull, push and pull. And then we'll do the same thing on the other side. We're going to push toward and pull away. And you should actually feel that skin move under your fingertips a little bit. All right, now that we've opened this up, we're going to hit a pressure point on the front side of the shoulder blade. So we're going to put the arms right down on the side like this. And then you take your hands and you find the edge of the shoulder blade, and you're going to dig right underneath it, and then push up, and you'll feel the front side of the shoulder blade. Now there's a pressure point here that is for shoulder pain and upper back pain. And all you want to do is apply some gentle pressure. One area could be very sensitive, even ticklish. And the other, people with shoulder, upper back pain, neck pain, this point might be very, very sore. So all you want to do is put enough pressure to feel the underside of the shoulder blade and hold it there. Maybe 10, 20 seconds. Most of the time, underneath your fingers, you will feel the tissue let go. It'll feel like you're not pushing as hard, or it may feel like there's, say a balloon. If you push on a balloon and the air goes out, that's what you might feel. So maybe 10, 20, even 30 seconds. But again, it should not be uncomfortable. But you do need to apply some pressure. We've held it for a few seconds here. Again, maybe 10, 20, 30 seconds. And I did feel that tissue let go. It did release. So after we're done here, after you release that point, now the upper back here that we opened up before we hit the pressure point, we're going to close. So we're going to take those 3 points that we opened, and we're going to close them. Pulling away and pushing toward the spine when you close. Push away, pull toward. There. Now, we're done. Give this several minutes, 2, 3, 4 minutes to all settle in, and then we're gonna turn her over and work on the front side and the head and neck area. All right, now we've got our headache sufferer or our victim on her back. Now it's time to do some of the releases around the head and the neck area on the muscles that are actually causing your tension headache. So first thing we're going to do is we're going to come in right on the trapezius muscle that's right on the top of the shoulder there. So we're going to use the same push and pull technique. We're going to take right in the middle of the traps. We're going to push and then pull on both sides, push and pull. And then we're going to do the same thing behind the neck here. And we're going to look right at the base of the skull here, right where the muscles insert into the skull. We're going to do the same thing. We're right next to the spine there. We're going to do a push toward the spine and pull away. And we'll do that on both sides. And then we'll come down about halfway, and we're going to do the same thing right next to the spine, the muscle there. We're going to push and pull away, push and pull. Then from there, we're going to move to the shoulders. Takes care of your slouching. So we're going to reach behind, underneath the shoulder, and we're going to do the same thing. We're going to push and pull on both sides. And then we're going to do the same thing on the front. We're going to take right on the front of the shoulder. We're going to push it and pull it, push and pull. And then from there, we're going to look at the collarbone. On the inside of the collarbone, right next to the neck, we're going to do the push and pull, but along instead of across. So we're going to find the inside of that collarbone there, and it's going to be a push and pull right to the middle. And then we'll do the same thing on the other side. All right, so after we've done the push and a pull along the inside of the collarbone here, now we're going to start to work on the back side of the neck muscles and then some of the front. So I'm going to get my stool here, and we're going to continue. Okay, make sure everything's relaxed. Now, what we're going to do is, when we did on the back, we did a push and pull along the spine. We're going to do the same thing on the neck area. All right, so what we're going to do is we're going to start, and we're going to do the release right next to the spine. And we're going to look and find that real big bone that sticks out of people's necks. And that's where we're going to start. Right next to that bone, we're going to do a push and pull right along the spine, right up to the skull. Maybe 3, 4, 5 moves, depending on how long their neck is. And again, you're not pushing very hard. In most people, this area will tend to be very sensitive. All right, then after we've done that, we're going to, instead of going right next to the spine, we're going to go right to the muscle next to it. And you'll feel, usually this muscle feels tight, swollen, and tender. And to work this muscle, we're going to use a little different technique. And what I'd like to do is take my middle finger, and we're going to do a little rubbing or a circular motion on the muscle tissue. So I'm going to start right up where the muscles come into the skull. A little bit of pressure on both sides, and then I'm just going to make little tiny gentle circles with my fingers. And I may do this for 10, maybe 20 seconds. And if you do it gently enough, you will actually feel the tissue begin to change under your fingers. It will actually begin to let go. And then we're going to move down. And again, right in the muscle there. And we're just going to do some gentle circular motions here, right in the middle of the muscle belly. And you will actually feel that tissue relax. And then we'll do one more very close to where we started before. Again, right in the muscle tissue. And we're going to make small circles just like this. And again, very little pressure, push into the tissue, but this is not a deep tissue technique. It should not hurt. If the area is very, very sensitive, you can use a very, very light touch and you will still get results. Good. Now we're going to use the same technique, and what we're going to do is right on the base of the skull here, we're going to do the same thing to the musculature as it follows the skull. So we're going to start right by the skull there, and just below it, where the muscle inserts into the bone, we're going to do the same thing, and we're going to do it on both sides. I usually find it easier to do both sides at once rather than do one side and then the other. And then we're going to move over about a finger's width. And again, we're going to make small, gentle circles. Doesn't matter which way you go, clockwise, counterclockwise. And then the last one is right at the edge here where that skull makes a turn there. So we do the last one right there on the muscle. And a little tiny bit of pressure. There we go. Okay, so I always check, make sure staying relaxed, and if you want in between, you can always do a push and a pull again on the trapezius if you so like. Now we're going to do some releases right around, specifically on the neck muscles, a couple on the head, and then we're going to stimulate some neurovascular points. All right, so the muscles around the neck here. Notice if we turn the head a little bit and just lift your head up a little bit. All right, you see that muscle stick out? A lot of people with tension headaches, because they have a forward head position, this muscle gets real tight and knotted. So that's the one we're going to loosen up. So what we're going to do is we're going to do the same thing. We're going to push across and pull. We're going to push over the muscle and pull back across it. And again, gently, you're not digging into anybody's neck, and this should not hurt. And then obviously we'll do both sides here. All right, and then the next thing, you've got your temporomandibular joint, or TMJ. So if you have TMJ or TMJ problems, this joint right here. And so we're going to do two moves across this joint. You'll find the joint right there. There's a little indent. So you're going to push and pull across the joint, go below it, and push and pull across the joint. Again, and we'll do that on both. And we'll do that on both sides. And then, right along the jaw here, we're going to do the same thing. We're going to do a push and a pull with the bone, just like we did on the spine. And now as we, now to release some of the muscles up in the head area, we're going to start right by the eye there, and we're going to do a push and a pull in a straight line so that you end right above the ear. And we'll do that on both sides. And the last muscle release is we're going to release the muscles across the top of the eyebrows here. So you pinch the bridge of the nose, and we're going to take and we're going to push just over the eye socket and pull back over the bone. And you want to do that on both sides. All right, so after we released the muscles here, the next thing we're going to do is stimulate 3 neurovascular points. Now, a neurovascular point is where there's a collection of nerves that are very close to the surface. And these neurovascular points correspond to various muscle groups in the body. And the ones that we're specifically going to hit here are for the head and the neck and the top of the shoulders here. So we're going to use the same circular motion. And the first one is going to be right here, next to the eye. And if you come right past this little tiny ridge here, you'll feel a little tiny indent. And that's where the neurovascular point is. And we're going to use the same technique where we're just going to make little circles. Same thing, very light touch, and we're going to circle. And the same thing, we're going to do this maybe 10, maybe 20 seconds. In most cases, not all, but you will feel the tissue change here. We're not stimulating muscle as much as we're stimulating the nerve endings here. And the second is right on the forehead. Now, if you run your fingers over here, you'll feel two tiny, tiny little bumps. And that's where the next neurovascular point is. So the same thing. We're going to take right on those two little bumps, and we're just going to make, just going to circle just like this. Now, I mentioned at the beginning in the introduction that there are several points here, or muscle groups, that you can stimulate by yourself. And these neurovascular points are a couple of those groups. And again, this is very gentle. If you notice, most people will rub their heads like this, or rub their hand over their head when they have a headache. And they're actually trying to stimulate the neurovascular point. And it would be better if you did it very gently right on the top of these two ridges. And then the last one is going to be right at the top here. So if you run your finger down, and just as the skull begins to flatten out here, if you put your finger here, there's going to be a little ridge. You'll feel just a little tiny bump, and that's where the last neurovascular point is. And we're going to do the same thing. We're going to rub that. And I've actually had patients tell me that when I stimulate this point, they could feel a numbness or a tingling that goes down the side of their face into their arm. So this area is crucial, and sometimes it can be very tender. So again, it's very gentle. There we go. All right, so there you have it. That's the whole technique. It doesn't seem like we did much, but all of those movements across all the tissues and the bony prominences and the neurovascular points signal the tissue to begin to relax and realign. Now, any of the points, the musculature, back of the neck, the head area, where we did the small circular motion, is you can stimulate those on your own. Again, be gentle, do not push, and do it 20, 30 seconds until you can feel that tissue release. Now, two things. About half the people that I do this to the very first time tend to get real sore and achy. And that achiness, or sometimes pain, comes from a toxin release. As that tissue unwinds, it'll release toxins, and that's where the pain comes. Happens the first time, and I don't remember that it happening a second time if I've done it. So extra fluids over the next 24 hours certainly will make a difference in helping flush some of those toxins out. So if you do have any questions, please avail yourself to the information that's located on our website. Thank you.